Thank you so much. I found this whole set of talks very inspiring in terms of what can be done through local action and local organizing to address these problems in a very, positive and constructive direction. So while we're waiting for people to go to the mics to ask questions and encouraging those on the internet to send their questions in as well, I have a question. I think we know from the science that it's really urgent that we take very transformative action very quickly, because we're blowing through what scientists call the carbon budget, and every day that we don't take action actually increases the risks of more catastrophic climate change and more impacts for future generations that we won't be able to undo. So from where you sit in a very conservative state, but where you're all doing this positive work, I'm wondering what you see as our role in the health sector to help you move things along faster and scale things up.
I'll say on our end, it's been great to work with the team at University of Louisville. They need to understand a little better the effects of climate change. Everything that we've talked about so far this morning, they could have a better understanding of that. They've been great at showing, and I'm not just singling them out, but it's been wonderful to have them on the team and understand the health data that we've found out from, say, for example, Green for Good. But I think the education of the healthcare folks around the climate change and all of these conditions that we're going to see going forward is really important, just to keep that present and interwoven through the work that you all do.
Yes, I will add that it's all interconnected, right? So health, to make sure that we think about health from a really holistic perspective, for us, spiritual health is crucial, as is physical health, economic health, environmental health, and that we can't, disassociate one from the other. So, and I think, Jonathan said so well, like, these are solvable problems, okay? And the frame is important, and so I think framing climate change from the health perspective is critical, but also I'll add the layer over that of that we're not just talking about physical health, we're talking about the whole picture. So continuing to echo that and finding, good examples of where you can highlight it is certainly going to be beneficial, I think, to other communities who are trying to do this work.
I think if part of the question was how can the health community really help amplify and accelerate the sense of urgency and what's required, I think on many, many levels, really, the fact that 2017 is the year of climate change and health, right? That speaks volumes. That's huge. My message would be to be bold and really stand with communities that are facing these issues on the ground. 2 years ago in Louisville, I attended a really wonderful big conference on improving air quality in the city. And it was well attended by many sectors, but including the movers and shakers in the city, the Humanas and the UPSs and et cetera. And it was an entire day, 300 people, workshops, speakers, really good data and information about the health impacts of poor air quality. And the word coal was never mentioned. It was never mentioned, right? So we talk about evidence-based and data-based work, but if we're not willing to talk about the evidence of what is actually causing some of the most significant health impacts, then the only voices doing that are voices on the margins of political power, and that makes it very, very difficult to actually build political will. So for people who have positions of power, whatever that may be, we really need to all be bold enough together to say what's truly going on and what's needed.
You want to say something on this, or?
I think
Okay.
I'd love to hear additional questions.
Why don't we start questions?
Hi, my name's Kelly Dennings again. Kind of taking something that we talked about in the last session about the need to transition folks, especially in Kentucky, from the traditional energy sector that you guys have. I was wondering if you are addressing that at any of your organizational levels, and I would personally tie that to a mental health capacity and how that, would affect health and the members of your community.
I wanted to just mention that we have a goal in Louisville to reduce energy use per capita 25% by 2025. And so one of the things that I mentioned at the closing of my comments was that we want to engage a biostatistician to help us understand the improvements to air quality that we would get by achieving that, and then therefore the connections to health. So my approach to that is that by getting that information, you then can couch everything around energy efficiency and conservation, and yes, reducing dependence on coal-fueled energy, then has the health impact. So if we put the health part first in promoting our energy goals, then that's going to kind of maybe defray a little bit the political sensitivity of it.
Yeah, I think that's important. Our organization does work in the eastern Kentucky coalfields. We have less membership in the western part of the state and the western coalfields. And yes, the impacts of job losses, I think it's about 13,000 coal mining jobs have been lost since 2009. These communities are already among some of the nation's poorest counties in the country, even when the coal industry was doing well. So the loss of a really major sector and some of the best paying jobs in those communities has hit the communities hard, and they're struggling on multiple levels, as communities in economic distress do. So population loss, mental health and drug abuse issues, revenue loss to the local communities, so their ability to, their resilience in dealing with some of the impacts is really challenged. There have been small but important investments made by the last administration. There's a lot more that could be done, both by the state of Kentucky and from the federal government, to really provide the kind of comprehensive support at multiple levels for those workers, yes, but also frankly, for women heads of households in the communities who have never had good economic opportunities in those communities, right? So thinking about a just transition, I think, has to include the directly affected workers, but also include the broader community in which they live. We do try to address that. Our organization is working to pass some federal policy that would direct about $1 billion towards land and stream restoration, which would have ecological benefits, but also obviously be a job-creating force. And frankly, we think that a lot of the work to push towards more energy efficiency, as Maria was saying, has the potential to drive local job creation. So some of that work can contribute.
First, profound congratulations. Who knew Kentucky was so cool? I love it.
You need to be cooler.
And so I'm Gary Gunner, so I'm a member of the Round Table. I'm also a Baptist minister, and I work with a lot of faith-based healthcare systems. I'm curious about your experience. It can't be that hard to get an Episcopalian church to buy into this. Where's Southern Seminary? Where's the United Methodist Bishop? Where's the Baptist Convention of Kentucky? In all of these areas, about where are you seeing the capacity to engage the more conservative religious networks around these profound themes?
Oh, go ahead.
Okay. Well, first of all, thanks for the congratulations, and give us 5 minutes, we'll get there.
Yeah. Okay.
No, so I do think, similar to working with any institution, a lot of it has to do with how we frame things. I will say that in those instances where we're not directly working on issues like climate change or energy dependency, the foundation is there in terms of stewardship and land care. It's just a matter of figuring out how to speak about it and figuring out what matters to those communities and how you speak about it. So for example, if water quality is an issue, well, water quality is a sort of upstream, downstream issue that needs to be approached on both sides. But at the end of the day, what do people care about? Do they care about the water in their glass? They're not necessarily as predisposed to thinking about what happens with the forested areas that are protecting the watersheds that produce that water. So I will say that, to your question, I wouldn't go so far as to say that those folks aren't engaged. It's more of a matter of finding out how they are currently engaged, what those issues are, and where the alignments are in our mutual goals and mutual agendas. And I will say that for those that don't know, it's actually the evangelicals that put faith-based environmentalism on the map, as you probably already know, but it's worth mentioning. Pope Francis is wonderful. He's sort of the poster child for, modern environmental consciousness of the faith-based institution or individual. But faith-based environmentalism is fairly old, or at least in the contemporary sense. I mean, we can go all the way back to St. Francis and Thomas Aquinas, and even before that, or maybe Jesus. But the point of the matter is that there are folks that are engaged, that their level of engagement or their type of engagement may not necessarily look exactly like what we've discussed, but it's there and the foundation is there for those partnerships to be formed.
And I guess I'll add to that. For our organization, this conversation is not new. Like I mentioned, we've been hosting an event in Louisville called the Festival of Faith for now our 22 years, and we did an entire series on the elements. So each year, the first year we started with sacred water, sacred soil, sacred air, and then sacred fire. And one of the things that we have found in offering these forums on dialogue, conversations on meaning, is that the environment actually tends to be, dialogue around the environment within multi-faith conversations tends to be a unifying topic as opposed to an issue that separates. So I'll offer that out there. And I will say that we constantly reach out to everyone in our community, invite them to come to the table. And there are differing responses of who shows up in the audience from day to day. But we have tremendous leadership. We welcomed Prince Charles to Louisville, was it 2 years ago now, to talk about this important topic and his principles of harmony, and that, we are the environment, nature is in us, we are nature. And the head of the Southern Baptist Seminary was at that talk. So there are opportunities, and seeds are being planted in interesting ways, and we recognize that it takes a little while for them to germinate, but that doesn't mean that they're not starting to grow a little bit.
Cool. We won't quit until you quit.
All right.
Way to go.
Thanks.
We'll be here all day then.
My name is Dick Zimmer. I'm a member of the Environmental Health Roundtable and a former Republican member of Congress. I have two questions for Lisa Abbott. Could you explain more fully what you mean by just transition? Specifically, what will an unemployed coal miner do other than clean up streams? And secondly, what, if any, role for nuclear power does your plan have?
Sure, thanks. I would love to continue the conversation about just transition. I'll do my best in what I hope will be brief, but it's a longer conversation, so I'd welcome that as well. I think the phrase just transition comes out of union movements and specifically around plant closures. And I think for us, talking about just transition in the context of coal mining regions in Central Appalachia, we are really working to broaden the term to include the whole community in addition to the affected workers themselves, because frankly the economies have, there are areas of some of the most persistent and deepest poverty in the nation, when the coal industry was well. So the whole region is in need of a just transition. We have identified a number of principles, and I'd be glad to share those with you about what that means and what it looks like, as well as a set of policies that would help, right? We don't have all the answers, but there are things that could be done today to support a just transition. It includes some of the foundational parts of any healthy community, so I think it includes supporting a strong, healthy safety net, including our healthcare system. It includes strong local schools, right? And then absolutely a just transition includes opportunities for job training for meaningful jobs, not just job training for job training. It includes investments in job creation, and I'll talk some about where I think there are opportunities in the region. And it includes also ensuring that there are some workers, let's take the railroads in Kentucky, right, where they've hauled coal. There are folks working on the railroads who just have been laid off in the last couple of years because there's much less coal being moved. They've worked for 17 years, but they don't get access to their guaranteed pension unless they put in 25 years, right? A just transition really has to take into account that worker is not likely to be trained into another job that will provide a similar level of job-sustaining support, and there has to be public investment in supporting those workers, whether it's through a buyout or through ensuring some health and safety benefits to bridge them to the point of retirement. There's a set of workers who absolutely have skills that can be redirected towards other careers that can provide family-sustaining wages. In Eastern Kentucky, the economy as a whole is not healthy, but there are opportunities, and some of those opportunities, as I said, are in land and stream restoration, really trying to repair some of the legacy of extraction. They're in forestry and sustainable forestry. They're in energy efficiency and renewable energy growth. They're in the healthcare sector. There's a set of, there is the opportunity to really nurture and build tourism and arts and crafts in a way that maybe isn't the pathway for that displaced miner, but might be the pathway for their child, right? So there's a whole set of approaches that are needed. My husband, who also works in related fields, says the good news is it's long, slow, and expensive, right? So we know what is needed. We've actually known for a really long time, even before the decline in mining jobs. And it isn't all public investment, but it is good public policy that can help support and spur private investment as well.
Thanks.
Nuclear power. Kentucky has had a ban on nuclear power.
Make it quick because we do
Yes,
have just.
Kentucky's had a ban on nuclear power since the 70s. There is an effort in our legislature to remove that ban. In our study, we did not include it. It was mentioned occasionally as we went around the state, but very rarely, and it was equally mentioned as let's advance nuclear power as let's never advance it. So clearly no consensus. The analysis that one of our utilities just did in the state, Kentucky Power, looked at their next 15 years, and they ruled out nuclear power because it was the most expensive of the options they looked at.
Thanks.
Hi, I'm Kathy Bozzi. I'm a member of the Population Health Roundtable, and I want to thank the panel for some very good work and for sharing that with us and taking the time. My question is related to this, Lisa, your Empower process here. I think the process was great, but you started your talk with the fact that there was a difficult landscape with the governance position on this. And although you've got this plan in place, has that been brought to the state governing authorities? What's the reaction to that? What's the next step of that process?
Yeah, I do think that a primary goal for the whole plan is building political will in Kentucky to take the steps that will produce better outcomes for Kentuckians, right? And so your point is very well taken. Our plan isn't out yet. It won't be out until mid-April, so at that point we do intend to have briefings, meetings with individual lawmakers, as well as some public presentations of the plan. And absolutely, we will continue to work for policy change, incremental as well as some sort of blue sky policies. Frankly, I think the other way that this plan, I hope, will be used is people thinking about running for office in 2018 and 2020, who can grab onto some of the ideas and some of the outcomes and say, look, there's some steps that Kentuckians can take to create jobs and save money and improve health. Why don't we do that?
I want to just ask if any of the other of you want to make a particularly, Maria, any quick comments on where is the political will for doing what you're doing in Louisville coming from?
We have strong local leadership. Our mayor, when he came into office in 2011, formed the city's first ever Office of Sustainability when I was appointed, and he understands that it's the right thing to do for, just people in general and for the environment.
Mary Pittman from the Public Health Institute and a member of the Population Health Roundtable. My sisters were born in Ashland, Kentucky, and I went to school in West Virginia. And I know the culture of coal country is a bit different than an urban center. I wondered if you could talk about the different strategies that you take to try to scale what you're doing in an urban environment. And this is building the political will, but it's also looking at what's the culture and the shift towards more of a culture of health, a culture of environmental sustainability. It's not just to Lisa, I think it's to the Louisville folks as well.
Yeah, I'll go back in time personally for a minute to help answer that question, which is I moved to Kentucky from Boston, Massachusetts. I had been working at the regional office of EPA there, and I moved for love. My husband was from Louisville, and so we relocated. And the first gig I took after leaving EPA was working at the State Pollution Prevention Center, and I was on working in an energy efficiency program with schools, and I had 30 school districts in eastern Kentucky. I went as far east as Bell County. You know the state a little bit. So, I was down there in the heart of south central eastern Kentucky. And in response to your question, just one of the things that I quickly learned from working with those school districts on putting together energy management programs and incorporating the behavioral changes that are required to do this work was that even if the superintendent or the adults that were sitting around at the table didn't quite buy into it or weren't 100% behind this green movement, they knew that their kids were. Like, there was already a sense and feedback that I was getting, and they were just like, well, we have to do this because, our kids are talking about it all the time. So it provided for me personally a lot of hope that, the next generation isn't, even in, Appalachia, is starting to recognize the importance of this earth that we call home, and the fact that what I do, to my planet, I'm doing to myself. So I'll just offer that seriously as a personal anecdote, that I think that there is change afoot, and I feel like your presentation kind of offered that as well based on the work you were doing in preparing the program.
I love that. I think I have a good friend who says culture eats strategy for breakfast every time, right? Culture really matters. And so in our messaging and in our organizing, who are the faces of whatever is being said, who's helping to bring the messages forward, it just really, really matters. And I'd be glad to talk more offline about how we attempt to do that, and there's obviously, we haven't figured it out.
I think we have time for one last question.
Yeah, I think it may be a little quick. John Baldock from Cambridge, Mass. I was wondering how the business community is responding to your work, especially in Louisville, but also with the with the larger statewide plan, and what's sort of their response, and also what role might they be playing?
The response, can you repeat the last bit of that?
What's the response and the role of the business community?
Well, it's been a little bit mixed. We have some Fortune 500s in Louisville that have corporate headquarters, and they're obviously very into corporate responsibility. But in terms of, I think, some of the local business groups maybe have been a little less receptive to the heat management study, even to the tree canopy study, and with the worry of regulation. So to the extent that we make everything voluntary and provide incentives, it hasn't been bad, but there are those that have been really warm and receptive to, yeah, we want to pitch in, we want to help manage heat, come help us figure out where to plant trees on our property, those kind of things. So by and large, we promote that trees keep us healthy and manage heat and absorb stormwater, so that aspect has been pretty positive.
And just quickly want to add that Maria and I both sit on the board of a local nonprofit called the Louisville Sustainability Council, and it's meaningful to me that on that board represented a lot of Brown-Forman Corporation and Humana and a lot of the larger businesses in Louisville, and they're showing up at the table, so that's a good thing.
We have time for one more.
Natasha. Thank you so much. I'm Natasha D. Jarnett from the American Public Health Association, but I am a proud University of Louisville graduate.
Go Cards!
I wanted to ask, you all spoke to, I think you pointed towards a lot of public-private partnerships, and I wanted to know if you could give some insights on how to facilitate those to move climate action forward, and also the benefits as well as the challenges of facilitating those. Thank you.
Crickets? Well, I mean, what I had hoped to peel back on our presentation was that there, whether it's working with faith communities or working with the corporate world, you just, check your agenda at the door. Like when you show up, like if the Nature and Conservancy had showed up at our door and said, we think it's really important that you do this. If the city had shown up at our door and been like, you got to do this in order to, I think it wouldn't have been well received, and ultimately it wouldn't have been successful. I mean, we all know the importance of establishing good buy-in. And I'll go back to what I said, which is it's all about relationship, right? It's our relationship with ourselves, our relationship with each other, and the relationship that we have with the earth. And that all has to change. And so to the extent that you can begin to take this approach of co-creation of, we understand what the issues are. We don't have to argue about the fact that there's, increased deaths from the urban heat island. I mean, we get that. Let's agree that we get that, and then let's just talk about how we can work together through our shared values and our shared needs to create something that will be positive and sustaining. And that is what has occurred as a result of our partnership with the Nature Conservancy and Green Faith, is this really robust program that I think will have tremendous impact on our community and hopefully assist the city in achieving their goals. So you see the mutual need and the shared values through non-governmental organizations, governmental organizations, and corporate America.
So our time is up. I'm sorry that we can't keep this discussion going. I want to thank all of the panelists for a very thought-provoking, but also very optimistic panel. And I hope you all will take advantage of opportunities later in the day to chat more with all of these excellent presenters. Thank you very much.